Good morning, happy morning. Easy Physiology for TN Medicos channel இன்னைக்கு வீடியோ February 2021 Physiology paper 2 MCQ 11th to 20 MCQ we are going to discuss. Before going to the MCQ, I have to share few points. இப்போ வெளியே நிறைய ஃபீவர் கேசஸ் இருக்கு. அதனால நீங்க உடம்பு நல்லா பார்த்துக்கோங்க. வெளியே போகாதீங்க. கட்டாயம் வெளியே போற சூழ்நிலை இருந்தா கட்டாயம் மாஸ்க் அணிந்துக்கோங்க. அப்புறம் அட்லீஸ்ட் ட்ரை டு ஸ்லீப் 6 to 7 hours. ஸ்லீப் இம்பார்ட்டன்ட். நல்லா தூங்கினா தான் we can memorize and reproduce. அப்புறம் பாஸ் ஆகிறது ரொம்ப ஈஸி. ரொம்ப ஸ்ட்ரெஸ் எடுத்துக்கிற தேவையில்லை. இப்போ உள்ள சூழ்நிலையில் ஃபெயில் ஆகிறது ரொம்ப கஷ்டம். அதனால் ஸ்ட்ரெஸ் இல்லாமல் படிங்க. நவ் we can move to the MCQ. 11th MCQ. Counter irritants allay pain 5. Counter irritant means இந்த அமிர்தாஞ்சன் விக்ஸ் அது மாதிரி உள்ள கவுண்டர் irritants. இப்போ வலி எடுக்கும் போது பெரியவங்கலாம் அதை தேய்ப்பாங்க. That relieves the pain. By which mechanism? A. Option A. Spatial summation. Yesterday also, last video also we discussed. Spatial summation is the instead of repeated stimulation in the postsynaptic membrane, 2 or 3 presynaptic neurons simultaneously stimulate the postsynaptic membrane. That is spatial summation. It is not the correct answer. And adaptation of the receptor. Okay. So failure to stimulate the sensory cortex due to the failure of the transducers due to the repeated stimulation. That is the adaptation. நம்ம அடாப்ட் ஆகிடுவோம் பெயினுக்கு, கிரானிக் பெயினுக்கு. தட் இஸ் அடாப்டேஷன் ஆஃப் தி ரிசெப்டார்ஸ். That is not, this is also not correct answer. Option C. Inhibition of the pain pathway at dorsal concave. So this is the correct answer. So according to the gate control theory, dorsal con is act as the gate for the transmitting the pain sensation. Okay. So the counter irritant inhibit the gate to transmit the pain sensation. So this is the correct answer. Option D. Inhibiting the release of pain mediators. So this is not the correct answer. So in endogenous analgesic system release the endorphin and enkephalin in the chronic pain sensation. So this is not the correct answer. Correct answer is the inhibition of the pain pathway at dorsal concave by gate control theory. 12th MCQ. Pure word blindness occur in lesion of. What is pure word blindness? The pure word blindness patient can write. If we dictate something means they can write, but they cannot read their own writings. Okay, that is the pure word blindness. அவங்களால நம்ம சொன்னா அதை எழுதிடுவாங்க, புரிஞ்சு எழுதிட முடியும். ஆனால் அவங்க எழுதினதையே அவங்களால வாசிக்க முடியாது. ஸோ விச் லீசன் ப்ரொடியூஸ் த பியூர் வேர்ட் பிளைண்ட்னஸ்? இதில் 4 ஆப்ஷன்ஸ் இருக்கு. சுப்பீரியர் டெம்போரல் கைரஸ், inferior temporal gyrus, middle temporal gyrus, angular gyrus. இதில் ஒன்று தான் ஆன்சர். ஒரு 3 டிஸ்ட்ராக்டர். இதில் ஒரு ஏரியா the imprinted words. So the printed words is converted to speech by the one area. That area is the correct answer. That area is called as the angular gyrus. So this angular gyrus convert the printed word into the speech format. So defect in the angular gyrus produce the pure word blindness. So 13th MCQ, easy MCQ. The following is true regarding the surfactant lining the alveoli. Option A is produced by alveolar type 1 cells and secreted into the alveolus. This is not correct answer. Surfactant is produced by the type 2 alveolar cells. Type 2 alveolar cells. Option P help to prevent alveolar collapse. So this is the correct. So this is the correct answer. Option C is increased in the lungs of heavy smokers. So in the smokers having the less amount of the surfactant, it is decreased. Option D is a glycolipid complex, mainly lipoprotein complex. Okay, type palmitoyl phosphatidylcholine. The lipid is main content, and protein is certain amount, the lipoprotein complex. It is not the glycolipid complex. So correct answer is help to prevent the alveolar collapse. So 14th MCQ, spontaneous respiration stops after option A, transection of the brainstem above the pons. So if the lesion occur above the pons means the respiration, normal respiration will be there, quiet respiration will be there. So this is not the answer. Option P, transection of the brainstem at the caudal end of the medulla. Caudal end means tail end, below the medulla. The transection lesion occur below the medulla means, so the medullary control is lost. So respiration completely stopped. The respiratory arrest will occur. So this is the correct answer. Okay. The correct answer. So option C, we have to discuss other distractions. Bilateral vagotomy. So if you remove the vagus, what happens? Normal respiration will be there, but the amplitude will increase. So it will control the inspiratory effort. So amplitude of the respiration is increases. Option D, bilateral vagotomy combined with transection of the brain stem at the superior border of the pons. The same option like option A. So normal respiration will occur, no change. Okay. So correct answer is transection of the brain stem at the caudal end of the medulla produce the stop the spontaneous respiration. 15th MCQ, the pacemaker cells initiating rhythmic respiration located in medulla responsible for normal respiration is. So option A, apneustic center. Apneustic center stimulate the medullary inspiratory center. So stimulation of the apneustic center produces a prolonged inspiratory effort. So it is not the correct answer. Okay. So pneumotoxic center role is inhibit the apneustic center. So it is an important switch for changing the inspiration and expiration, regular inspiration like the expiration. So this is also not the correct answer. The pre-Portingal complex. So this is located in the medulla. This is important for the rhythmic respiration of the normal respiration. So this is the correct answer. Pre-Portingal complex. It is located between the nucleus ambiguous and nucleus lateral reticularis. Fourth distractor, nucleus tractus solitarius. Nucleus tractus solitarius. So dorsal group of respiratory neurons situated in and around the nucleus tractus solitarius, that is important for the inspiratory effort. So correct answer is the pre-Porsinger complex. 16th MCQ. Shifting of oxygen hemoglobin curve to right means option A, decreased O2 delivery to tissue. So this is not the correct answer. So the shifting right side means the affinity of the hemoglobin to oxygen is less. So this is not the correct answer. Option B, increase oxygen delivery to tissue. So this is the correct answer. So the more oxygen is delivered to the tissue. Other options, loading of carbon dioxide to blood. This is wrong answer. Loading of oxygen to the blood. This is also wrong answer. So correct answer is increase the oxygen delivery to the tissue. What are the conditions? Shift the oxygen dissociation curve to the right side. Increase temperature, decrease pH, increase 2,3-diphosphoglycerol. These are the conditions. Shift the oxygen dissociation curve to the right side. So 17th MCQ. Which of the following sensation is carried by the lateral spinothalamic tract? Crude touch and fine touch. Crude touch is carried by the anterior spinothalamic tract. Fine touch is carried by the dorsal column pathway. So this is not the correct answer. Tactile localization and tactile discrimination also carried by the dorsal column pathway. So this is not the correct answer. Vibration and proprioception also carried by the dorsal column pathway. This is also wrong answer. The pain and temperature are carried by the lateral spinothalamic tract. This is the correct answer. Lateral spinothalamic tract is the correct answer. 18th MCQ. The diffusion of ions that causes inhibitory postsynaptic potential. Inhibitory postsynaptic potential is occur in the synaptic membrane. The action potential occur in the postsynaptic membrane is towards the hyperpolarization side, downwards. This looking like this. Action potential means upwards. This is downwards. So option A is increased conduction of the sodium ions. It will produce the excitatory postsynaptic potential. It will produce like this. So this is not the correct answer. And increased conductance of the potassium ions. This is the correct answer. So increased conduction of the potassium and the chloride ions only produce the inhibitory postsynaptic potential. So they give the one option. This is the correct answer. Other distractors, decrease conductance of the potassium. So this is not the correct answer. And decrease conduction of the chloride ion. This is also not the correct answer. Increased conduction of the chloride ion also produce the inhibitory postsynaptic potential. So in this options, option B, increased conductance of the potassium ion is produce the inhibitory postsynaptic potential. 19th MCQ. Rensa cell inhibition is an example of option A, positive feedback inhibition. This is not the correct answer. Option B, negative feedback inhibition is the correct answer. So negative feedback inhibition, spinal motor neuron gives the collateral. The collateral that is connected to the Rensa cell interneuron. That interneuron inhibits the same motor neuron. Okay, that is the negative feedback inhibition. Option C, negative feed forward inhibition. It is occur in the cerebellum. Mosey parallel fibers activate the inhibitory Purkinje cells. That is a feed forward inhibition. Postsynaptic inhibition is the directly inhibit the postsynaptic membrane. So options correct answer is the negative feedback inhibition. Rensa cell inhibition is an example of negative feedback inhibition. 20th MCQ. The auditory pathway passes via all except option A, cochlear nuclei. The auditory pathway passes through the cochlear nuclei. Option B, superior olivary nucleus. Auditory pathway passes through the superior olivary nucleus. Yes. Option C, trapezoid body. Auditory pathway passes through the superior trapezoid body also. Option D, superior colliculus. So auditory pathway not pass through the superior colliculus. It pass through the inferior colliculus and reaches the medial geniculate body and reaches the auditory cortex. The correct answer in this question is the superior colliculus. ஸோ இந்த 10 MCQ டிஸ்கஷன் உங்களுக்கு ரொம்ப ஹெல்ப்ஃபுல்லாக இருக்குன்னு நான் நம்புகிறேன். ஸோ இஃப் யூ லைக் திஸ் வீடியோ, share your friends and subscribe. Thank you.